Good morning, everyone. Thanks for joining us for this collaborative application preparation session. We're going to give people another minute or two to log on and join us. Invite people as you join to in the chat function. Write your name and the organization that you may be affiliated with for our records.
Good morning, Lloyd. Good morning, everyone. Lloyd, I'm going to step away and just get some more water and come right back, okay?
All right, sounds good. All right, it is 10:02 a.m. We're going to get this session started. I'm your facilitator and leader of the process of developing the collaborative application for the Continuum of Care Homeless Grants Competition. Appreciate everyone joining us. I'm also admitting various people along the way. For those who may be new to the process, the CoC collaborative application is a key part of the community-wide application for approximately $2 million of federal funds that are available to Durham to help us address the needs of people experiencing homelessness in our community. Primarily, these funds are used for supporting permanent supportive housing projects and rapid rehousing projects, so helping people get back into permanent housing. Funds are not available to fund emergency shelter operations and generally not to fund street outreach projects as well, or street outreach projects. We do use about $55,000 to help operate our homeless management information system, which is our community-wide database for people experiencing homelessness. In the interest of time, I appreciate people joining the call. If you have specific questions relative to what this is about, feel free to raise your hand or place questions in the chat, and we'll try to address those as time goes on. As I indicated in the message I sent yesterday to people who had joined us for the initial preparation session we held a couple of weeks ago on Friday at 10 a.m. There's basically three ways we're going to be operating this 90-minute session this morning. We'll conclude by 11:30 a.m. We don't anticipate that we're going to be done. We do with the collaborative application. We do have 3 additional sessions scheduled every other week between now and September 22nd. So additional sessions are scheduled for August 25th, September 8th, and September 22nd. And we do hope that you'll be able to join us for one or all of those upcoming sessions. We provided some background at our earlier session, but if we need more background, we can certainly address questions. Would welcome any, at this time, any suggestions for specific questions on the collaborative application that those of you who have had a chance to review the collaborative application and want to provide input about any specifics question. We sent that out, I think, after our session on July 25th to those who participated. And if you have specific suggestions, would welcome your comments and suggestions at this time. If there aren't any, we will certainly start working through the collaborative application from beginning to end. I see Ricky has raised your hand. Ricky, questions, comments, suggestions?
Okay, so I only made it through page 10 because it's busy, right?
Right.
But I have a couple of questions and then some things that I read that I was like, not sure about. So on page 2, there were 3 things that caught my eye in the organizations that participate in our CoC. And the first one was like, what struck me as people who participate in meetings, but we didn't record as, voting or participating in coordinated entry.
Okay.
And that was line 3 for disability advocates, line 7 for hospitals, and then line 9 for law enforcement. And so my question is like, who is our disability advocate? Is it that they're not a member of the board and that's why they don't vote? And then also with hospitals, I could have swore we had some hospital representation, but maybe we don't. Maybe we don't officially have that. And then lastly, law enforcement.
Right.
I was like, who is the person that participates in the CoC meetings?
All right. So great questions. Disability advocates, I think last year we said no throughout or for participated in CoC meetings. And as we move into that, let me first quote from the detailed instructions for 1B on structure and participation. It says, if you select set yes for participated in CoC meetings, you must select yes or no in the other 2 columns on this table. If you select no for participated in CoC meetings, you still can select yes for participated in CoC coordinated entry. And if participated in CoC coordinated entry system means that a partner is involved in the assessment and or referral process, not whether the partner participated in developing the coordinated entry system. So with that clarity, disability advocates, I think we were suggesting that participate in CoC meetings, that somebody like Sharita McCullers, who does some SOAR work, could be considered a disability advocate. I think when I Googled disability advocates in Durham, I ran across the Alliance of Disability Advocates, I think in North Carolina as well. Yeah, as well as Judith Romanowski, a local attorney that does some SOAR work or helps people with applications for disability benefits. Was referenced. The Disability Rights in North Carolina was also mentioned. So I'm not sure that Judith Romanowski is, or Billy Guthrie, who used to be a colleague of hers in her firm, are formally CoC members. But I do believe we can consider Sharita McCullers as a disability advocate.
So if we consider her as an advocate, she votes.
So we can say yes for column 2, as well as Jeff on the call. I'm not sure he's joined in.
Jeffrey Rawlings.
Jeff is here. He's
There,
muted.
Jeffrey. Okay.
Um,
Jeffrey, would you confirm whether any disability advocates like Sharita McCullers participate in assessment and or the referral processes?
Right now, I am not at my desk, and I can't hear you. I can't hear you well. I'm trying to switch over to audio directly into the phone because I could hear the talking, but it was kind of muffled. I do apologize. I'm trying to adjust.
That's all right. No worries. We'll clarify that later on. Okay, so we'll clarify that later on. In terms of let's really since we're starting with this table, Ricky, let's just go down the list. Affordable housing developers is certainly inclusive of Housing for New Hope. If you guys have been involved with affordable housing development, certainly Carver Creek could be considered additional housing development. So you guys would be across the board, right? The city is a CDBG home ESG entitlement jurisdiction, and we're certainly involved across the board. We also have while the department does not vote in CoC meetings, certainly as city officials, city council, as well as city manager's office are involved. So we'll clarify with Jeffrey on whether disability advocates participate in the coordinated entry system. Disability service organizations listed some. We can, I think we have listed this as yes in the past. The question is that really accurate? Should we change 4 to no?
Well, I mean, if you're saying Sharita is a disability advocate, then I'm like, we loop in the whole Lincoln Healthcare Clinic for the homeless, right?
Okay.
And so that's the way I see it. You
Okay.
know, other people may have different
Okay.
opinions on that.
Okay. EMS crisis response center response teams. So we're going to say yes on 4. Crisis response teams. We're primarily looking to the Durham County paramedics and Helen Tripp's work. Again, we can clarify. I don't think they're participating in coordinated entry, but they're certainly involved with CoC meetings and voting.
Yes, coordinated entry as well.
They are involved with coordinated entry?
Yes.
Okay, so we're going to say yes on that column. Homeless or formerly homeless persons. We know Angela Holmes and Angel Vic Lewis do serve on the CoC board. Are they also involved with a coordinated entry?
It's familiar. I'm gonna have to get with Melissa. Actually does the role on it, and I can't
Okay.
always see this on the call. So let me verify attendance and participation with Melissa, and then I
Okay.
can give you a definitive answer on that. Okay.
Very good. Hospitals, I suppose we consider, Eliza Matthew, the representative from Duke, as also representing the Duke Health System.
That's a stretch, Lloyd. That's a stretch.
Well, it is, but we have had a good conversation with Eliza just this week about, getting more commitment of healthcare resources, perhaps for the future, from the Duke Health System. We can say no on that if we want to.
Well, so question, Sally's group, Project Access, is that considered part of the Duke Health System?
That's
At
a good
all,
question.
or-
They're operating respite and they have strong connections to the Duke Health System. They have several doctors affiliated with Duke on their board. But
What about Julia Gamble?
well, again, she works for Duke Health, which is affiliated with the hospital. So,
And she and Sally both do attend coordinated entry as well.
okay, so we'll say yes to participate in coordinated entry. Shall we say no, that we really don't have representation in CoC meetings of hospitals? But yes, for participating in coordinated entry?
I think,
I think at this point.
yeah, I'm thinking it looks like, do Sally and Julia vote?
So Eliza is about to be the chair of HSAC, right?
Correct?
Mm-hmm. In like
And
3
she has
weeks.
been vice chair.
And she's been vice chair. So, that means that they're voting CoC board members.
Okay, so Ricky is asking in the question whether Eliza really is a representative of the Duke Hospital System.
Like, to me, that's a no. And I think, does Eliza represent the Duke University, like Office of Community, whatever the rest of
She's
that is?
the
Yes.
Duke Durham Neighborhood Partnership. Yeah.
Yeah, which is
Right.
not Duke
Not
Hospital.
Duke Health.
But she is, but like Lloyd said, she is actively interested in advancing the relationship with Duke. So I would stretch that one and go yes. But
We're gonna continue to say yes on that.
yeah.
Okay.
All right, moving on. Number 8 is non-existent as far as we know. Law enforcement. We did change the representative on the HSAC from a representative of police or the sheriff's office to a representative from the community safety department. But we do have good relationships with the crisis intervention teams, Officer Beckett and Corporal King and others have been involved. I think insofar as community safety is involved, we probably can say yes to both participated in CoC meetings and voted.
Who, Lloyd, I'm sorry, who votes? Because I didn't see law enforcement on HSAC.
Well, the community safety department is, I think we're suggesting is a proxy, is actually a better representative.
Okay, but who's
Or-
on HSAC from community safety?
Abena Bediaco.
Uh,
I think we can say yes on that.
I think it's pronounced Abena.
Abena, excuse me,
Mm-hmm.
Abena Bediaco. And Jeffrey, do you like Officer Beckett or other people, perhaps even community safety? Are they involved with any of the coordinated entry work? Prioritization?
Not to-
referral?
Not to my knowledge. But again, I'll check with Melissa to see if they're attending, but not maybe speaking.
Okay. LGBTQ advocates, there's certainly a CoC member in the LGBTQ Center as a CoC funding recipient, I think would, I'm not sure they participated in CoC meetings. They certainly are welcome to. Do we want to say that they vote in CoC meetings as well as participate in coordinated entry? I think they have attended some coordinated entry meetings. We'll check on that. Other thoughts about row 10? And let me, I'm going to share my screen for those of you who may not be familiar with this. Sorry for not doing that earlier. This is the table for those who may wonder what we're doing. This is the table we are reviewing. This is a key part of the whole section is related to inclusive participation. Does this make more sense, or anybody need more background on this? Okay, so we are on rows 10 and 11. We're saying yes across the board there. Local government again is consistent with row 2, which references entitlement jurisdiction. Local jails, we have one local jail, the detention center, and we've, as far as we know, do not have representation there, and we're comfortable continuing to say no on that.
Does no one from CJ, oh, is it
JRC?
CJRC? Yeah. Does no one participate anymore? But I don't know if that's like, technically like the local jails, but I feel like if we're stretching hospitals.
Right. We could, I'm not aware that we really have continuing collaboration with CJRC. I mean, we have some communications with them, but not much really.
Lloyd, could you just scroll up for a second? I didn't see the headings for the
Sure.
sheet.
Sure.
Thank you.
Okay, so this is a section, again, 1B1, inclusive structure and participation in coordinated entry. These are the instructions in the row 1. Select yes or no in the chart below. If the entity listed participates in CoC meetings, if they voted, including selecting board members, and they participated in CoC coordinated entry, and select non-existent if the organization does not exist in your geographic area. So you've got 5 columns really, numbered rows, and then organization or persons participated, and then the 3 columns, whether they participated in CoC meetings, voted in CoC meetings, and then participated in this coordinated entry system.
Right. Great, thank you.
Sure. All right, so we're down to mental health service organizations. Certainly that it would include Alliance, other contracted providers, but Alliance is our primary representative there. we'll check whether whether we have representatives in the coordinated entry system. Mental illness,
Yeah, totally.
totally they
I'm-
are. All right.
I'm sure Jeffrey will co-sign this.
Indeed.
Okay.
Yeah, well, I haven't been participating in coordinated entry system prioritization referrals for some time, so I'm trusting others to indicate that. I would say mental illness advocates would again include Alliance and other community partners. So if we're saying yes on 14 in terms of coordinated entry system, probably say yes for row 15. Organizations led by and serving Black, Brown, Indigenous, and other people of color. Urban Ministries is led by a African American. USA Veterans Help is also led by an African American. Others as well, so I think we can say yes on 16. Any questions about that? Similarly, row 17, the next page, led by and serving LGBTQ persons, again would be the LGBTQ Center primarily, which is led by members of the LGBTQ community, led by and serving people with disabilities. We know of any organizations led by people with disabilities?
Yeah, I had a question on that when I saw it, because I was like, who is that? But
I'm privy to whether someone is disabled. I know we service that community, of course, but I don't know if the agency is led by someone or any of the agencies is led by someone that has a disability.
Okay, so you are saying that there may be some participation with coordinated entry system in terms of prioritization and referrals?
Sorry, say that one more time. Sorry.
Yeah, I didn't catch your initial comment about led by and serving people with disabilities. Would you repeat that?
I said, well, we are definitely serving people with disabilities, but I don't know if any agency is led by someone that has a disability.
Okay. So
you know what? This has got me totally thinking, y'all are
Good.
going to come on this ride with me. So what would it look like if when we have new CoC membership or what have you, or maybe even like renewing CoC membership, like if there are certain like demographics that we know that we need for the collaborative like application, we could have somewhere in that membership agreement, like, do you identify with, any of these statements and like organizations led by and serving people with disabilities, like that would be one way of getting that info. Just a thought.
Yep.
Yeah.
It's a thought. Yep. Okay, so we're gonna, I think, put a question mark under row 18. Other homeless subpopulation advocates, I think that includes probably everybody on the call today and others. I think we can say at least yes on probably on 19. We can on column 2 we can say yes as well. That covers a multitude of sins, as we say in my faith tradition. Row 20, public housing authorities. We do have a representative from DHA on the HSAC as well as voting on the HSAC.
I'm sorry, Lloyd, if I could interrupt for just a second. If we could explore what Ricky said a little bit, I think that would be a really good idea. Is there a way that we could have that included as an optional section for people who wanted to join? And even if someone, because some disabilities are not visible, so someone
Sure.
may not want to reveal it. Could we have it as an optional section and then have it blind? We don't necessarily have to. Well, let's put a question: would we have to identify the person who has a disability or who fits any other demographics, or would we just need to be able to say yes to the question without being specific as to who it is? Could we include that as an optional section for our current and prospective members?
Okay, so certainly on this table, we're not clearly, we're not identifying the specific organizations. There's no follow-up questions. On the CoC membership form, I think a challenge would be to try to figure out ways to get information about all these, 33 rows of specific organizations. But I suppose we could add a section and list them and allow people to check a box. So that might be something that we can do more clearly on the CoC membership form.
I'm thinking maybe more separately, again, and looking specifically at disability portion, if someone did not want to reveal that, if we could do that, even if we sent the application to everyone, but then included a separate envelope, or
Right.
that'll probably be the best way to be anonymous with your reply,
Right.
and then have them be able to send that back to you specifically, and just have it coded that it's coming from someone who's you sent it to, but they wouldn't have to identify who they were. That way, we could possibly get information that maybe someone possibly didn't want to share and have their
Right.
name identified with it, but then we could capture the demographic without any
Right.
type of stigma being associated with it.
Right. I mean, there's options there. I mean, I think, as part of the CoC collaborative application process, we could send a questionnaire out to our membership, and ask people to provide some specific information about relative to this table.
I like that idea, Lloyd.
So,
That's
yeah,
got legs.
all right, so.
Regina's had her hand up for forever.
Go ahead.
Thank you. Yes, Regina Mays, and I would say that I represent a large demographic on many levels of which you're speaking about. I serve as a committee chair for CFAC, which is the Consumer Family Advocate Committee under Alliance Health for the Durham region. And so I do have some connects into those who are not only family members, but themselves suffer from things as far as mental illness and other physical disabilities. And so even listening to the questionnaire, I would say not everyone, but it is a definite time and frame where people are speaking up about their mental health and other disabilities. So even in discussion about the questionnaire, people aren't being so silent about those things anymore. And I think we can use this time as a momentum to uplift that and let them feel a part of that and acknowledge what their disability is. And for most of them that are part of committees like CFAC are finding the power to speak it out and speak up about it. So I don't think it's a hush hush thing, though. Yes, we do have some stigmas that in the general population is not as uplifted, right? And so people not so willing to speak up about it. But when you tap into these committees, people signed up to be an advocate for that, so the stigma can be broken down. And so I think when you're talking about questionnaires, to please consider that. Because people really put themselves on a limb, but that is something that they're willing to do because they don't want people coming behind them to feel the barriers of the stigma. And so they show people through their lives and their lived experience that you can speak up about this, and it's okay to ask for help, and it's okay to acknowledge that this is your disability, whether it's physical or mental health. So I just wanted to really uplift that. And I am a lived experience of experiencing homelessness that was awarded this chance in 2017 and have remained a sustainable housing and not had recurring homelessness happen even in my own family's life. And so if we can talk about and acknowledge the disparities that have transpired since from when my family was housed in a shelter that leads to people having that revolving door of homelessness, that just some of this discussions in some of these meetings are not brought up because people sometimes shy away from the topic and don't want to have the real conversation. So I have the lived experience of what real sustainability, stable housing looks like in a subsidized housing environment. Thank
Very
you.
good. Thank you very much, Regina. I appreciate all of those comments. Thank you for sharing, and thanks for joining this discussion. And your comments are very valuable to us, and appreciate that. So we're going to continue then with public housing. We'll double check whether the Housing Authority has been involved with coordinated entry, prioritization, referrals. I think, it may have been, I'm not sure that's happening though. 21, we do have good connections with Durham Public Schools and Ebony Ross. I think we can continue to say yes on that. We'll double check about their involvement with coordinated entry. Street outreach teams, certainly we have Housing for New Hope's teams are involved on many levels. Well, hopefully row 22 doesn't require a whole lot of discussion. 23 would be again Alliance, CoC, 24 as well. Any comments needed there? Again, we'll double check with Melissa regarding participation with coordinated entry. Agencies serving survivors of human trafficking, both the LGBTQ Center as well as the Durham Crisis Response Center have been serving survivors of human trafficking. Others may be serving them as well. We'll double check about participation with coordinated entry. Victim service providers, again, would be primarily the Durham Crisis Response Center. They are to be involved with both the CoC, participating in CoC meetings, although they've had a lot of transitions, but we're continuing to work with them. Community domestic violence advocates would be similar. Other victim service organizations. We do have families moving forward. Received a DV bonus project in the 2022 competition, and while they're not officially characterized as a victim service organization, I think we can acknowledge them as participating. Row 29, the State Domestic Violence Coalition. We really don't have ongoing communications with them. We do access administrative data that DCRC reports to the North Carolina Department of Administration about the level of services that they're receiving. They I think get a report out at least annually, if not semi-annually. But beyond that, we don't have a whole lot of involvement with either the State Domestic Violence Coalition or the Sexual Assault Coalition. Suppose we could reach out to see if they have any interest in submitting a becoming members of the CoC. Somebody just joined, or somebody needs, Jeff Rawlings needs to be admitted to the waiting room. Welcome, Jeff. Youth advocates. I think primarily we have focused on the Life Skills Foundation, both for rows 31 and 32. I think they're involved with coordinated entry. as well as row 33. And we have listed institutions of higher learning and community colleges. This is where, again, Eliza representing Duke, as well as Vega Swepson representing Durham Tech, as well as Colleen Herbert representing NCCU would be represented. Any comments then about any other aspects of this table? We can add another row if anybody else has another suggested organization to include here. All right. Then moving on, Ricky or others, did you have any other specific questions in or outside of section 1 that you wanted to address before we continue
Yes.
to scroll through? All right.
So on page 4, oh, I'm sorry, it's talking about 1B-2.
1B-2, which is
Yeah.
the open invitation for new members. All right.
Mhm. So on the top of page 4, I was wondering, like, are the answers supplied here like works in progress? Like it's
Yes.
ideas that are started?
It's all a work in progress. And you can see under paragraph 3, it starts with a question mark. So yes, it's all a work in progress.
Okay, well, because the last sentence in 1, just kind of ends like it's.
Yeah,
There's
and Ricky, just so you know, this process started by just copying over last year's information.
Okay.
And so we have started, in some cases, the questions don't change much.
Mhm.
And so it just requires sort of a reshifting of the same answer with maybe whatever updates are available. So I think this process started. You won't see that much in other questions, but in this first question, you ended up with ideas that were incomplete. But the
Okay.
rest of them should be okay.
Just checking. Because I was like, wait a minute, where's the rest of that sentence?
And we've got 2 conversations going on at the same time. So please either mute yourself or stick with the main conversation that we're having. And currently we're talking about section 1B-2, which concerns the open invitation for new members. So Ricky, you have the floor at the moment.
Oh, thanks. So now that we've got that settled, for 1B3,
1B3, strategy for soliciting, considering opinions on preventing and ending homelessness. Yep.
yeah, I feel like you can swap the response that you have for number 1 and put that in number 2, and then put the response that you have in number 2 and bring that up to number 1.
Okay, I'm going to over that one.
That's just my opinion, though.
Wow. 1 and 2. So reverse them. All right.
And also on that
Consider
same page, number 4, Housing for New Hope is the unsheltered coordinating agency, not unified.
Okay. Okay, identify. Thanks for that correction. I often get that confused. Gotcha. Thank you.
Yeah, and That's as far as I got. I stopped at the
Okay,
local education agency part. What is that? 1C4? That's as far as I got.
very good. Well, thanks for those suggestions. Does anyone else have any suggestions before we kind of read through it together? All right, so we're gonna continue then. We've got through 1B1. 1B2 is an open invitation for new members. And obviously we've done some work. Again, as Anthony mentioned, we are starting with what we communicated when we can about what we had in last year's application, if it's applicable to the question. Some questions change from year to year, some remain really identical. So there's three parts to this. How we communicated a transparent invitation process annually to solicit new members, how we ensured effective communication and access for persons with disabilities, and how we invited organizations serving culturally specific communities experiencing homelessness to address equity. I think so those are the three sections. Probably this is what we have so far. Obviously, paragraph 1 needs to be completed. Anthony, I think you may have added the question mark to the beginning of paragraph 3. Do you have a specific question?
No, and I went back and looked at the other answer from last year and there was no question mark there. So I don't know if I copied and pasted something and the text I was copying changed or what happened there.
Okay,
But I briefly glanced at the ones that follow and it doesn't seem to be an issue. That's what I was trying to say to Ricky, that we copied and pasted, and so I will go back and make sure. I do have the language from last year's. It was not messed up. There were clear and consistent answers in last year. So you know, I'll fix that. And you know, we can figure out what updates are necessary and discuss at the next meeting.
right. Does anybody have any specific thoughts relative to the third part of this question around organizations serving culturally specific communities experiencing homelessness, addressing equity issues beyond the LGBTQ center? I kind of sense that we're not, as a CoC, doing a whole lot to invite organizations serving culturally specific communities to help with address equity. Anybody feel differently or want to make comments about that?
I'm trying to think of the agency that's oh gosh, it's right downtown. Is it El Centro?
Responding.
The name escapes me. But like they're right in the downtown, you know, border. You know, a good little walk from CDD, Lloyd, if you wanted to. But like maybe just like a personal invitation might help. Like I know we do like a lot of emails and a lot of stuff goes out over the websites, but maybe like just a face-to-face, hey, you know, we'd love to be able to you know, have the voice of the people that you're serving incorporated into our system, because I think our reporting, you know, would show that we're serving very few Latino households or people who identify as having Hispanic ethnicity. But like, is that because there are other, resources in the community that they're connecting to that they don't actually enter our system? Or do they not even know that our system exists? It could go both ways.
Okay. All right, let's move on to.
I'm sorry, can I interrupt with a
Go ahead.
question?
Yes. Yep.
So when I think about especially other demographics like the Latinx community, I think sometimes we have to look at the definition of homelessness in Durham County. And so a lot of, it's just been my experience in community. A lot of the Latinx, they are staying in houses together, right? So per certain guidelines, and I know the school system is starting to revamp some things when they talk about children and connected families. The definition of homelessness may not be understood across the board, right? And so if you're housed and staying with a family, unless you have school-age children, you necessarily don't fit that homeless quota.
Mm-hmm.
And so though somebody may not have stable housing or housing of their own, that just my experience, and I would not take anything from El Centro because I know they do a whole line of work in the Spanish community that I wouldn't even begin to understand. But I just consider those thoughts that when people say, what is the terminology of homelessness within Durham County?
Okay, appreciate that. Ajax, you had your hand raised, I saw.
Yeah, thanks. Good morning, everybody. I'm a little bit of a stranger to the group. I thought I'd just say hello, introduce myself real quick, and if there's any part of this application that I might be able to weigh in on, I think it is this number 3. So Durham Community Land Trustees I've been working with for the past year as the pre-development manager, and I think that we would definitely qualify as an organization serving some of the communities mentioned in the item. A couple of important things come to mind. One is recognizing how for the Latinx community, many federal subsidy programs are not available for housing support because of citizenship requirements, and then also the issues that occur down at the courthouse where eviction diversion through legal aid often requires proof of citizenship in order to get support. And if you don't have that, then you get referred perhaps to one of the university civil law clinics if they have an opening. And then there's also the question of language support at the courthouse and between attorneys and clients who find themselves in that eviction pipeline. So kind of 2 different statements there. One is about DCLT as a I'm not sure whether or not I sort of just clicked through on your invite from this morning, Lloyd. I saw it at the last minute in my personal email, but not sure whether or not DCLT would be a good fit for participating in these conversations or not. Over time. We're certainly connected to many of the same people that you're that you're referencing. But I do think that the one of the things that's important to understand about our rental portfolio is that we have a significant number of properties that don't require proof of citizenship in order to gain access. And so we do have a significant Latinx population, both in our rental and our in our rental portfolio primarily. So just wanted to share that.
Sure. Well, thank you for participating and joining us this morning, Ajax. Appreciate that information about DCLT. DCLT is certainly doing some very important and great work in the Durham community, and certainly also qualifies as a affordable housing developer, as is listed in the first table under 1B1. I think the portfolio of the CLT is very important, and I think we certainly would welcome membership of DCLT if you're not already a member. I think we're in the process of inviting organizations and individuals to renew their membership. So it'd be great to have your membership and participation. Appreciate those comments. Continue with that. Let's continue then with okay, so that was 1B2. And 1B3. 1B3 concerns our strategies to solicit and consider opinions on preventing and ending homelessness. 4 kind of sub-questions that are listed here. I'm not going to read them to you because you guys can read. I think hopefully everybody can see my screen, right? If you can't see the screen, my screen, please let me know. You don't need to necessarily raise your hands, just participate in the conversation.
Yep, we can see it.
Okay. So our current response to this
This was the one that I thought you could swap 2 for 1 and 1 for 2.
Yep, gotcha. I think one of the questions we had was whether we want to reference currently in paragraph 1, the CoC also uses surveys distributed to CoC members to get feedback on priorities. I think we did that in 2022. Not sure we did that in 2023. So we may want to delete that reference entirely, although if we remove a time reference, I think we did in this reference to using surveys. We talked some this morning about using surveys to get information.
Would it be useful to consider the cross CoC evaluation as that we participated in earlier this year with Wake and the Orange County CoCs? I mean, like, did we get feedback? Yes, largely positive. You know, about the way our CoC organizations like adhere to housing first. I know this isn't a housing first question, so if there is somewhere else later in this application that talks about housing first, we could certainly throw that in there. But I also understand there's a character limitation, so you know, if it doesn't quite fit, scrap it. But when I think about, you know, the phrasing a broad array, like that would be, in my opinion, like the broadest, that we went outside of our CoC to get their feedback on how we're operating in Durham.
Yep.
But like I said, if there's a housing first section,
there is a housing first section, and it's even stronger than it used to be.
then save the cross CoC evaluation for that.
Well, we can mention it in both places. The reality is that you know, there's multiple people involved in scoring these various sections. So HUD is clear that you know, because you mentioned something in one section doesn't mean you can't mention it again, and shouldn't mention it again in another section of the collaborative application. So I appreciate that thought, and it's be a worthwhile one, particularly around them, particularly in them question 1.
I too have a question about the housing first motto under HUD, because I'm learning more and more about that. So with this team or collaborative, could you all see this collaborative to push the needle for more housing first models that fit the real needs in Durham. So I'm thinking along, I know that Housing for New Hope are doing their things, and I'm a part of certain activities that families moving forward, but it still seems to be like a missing gap, so to say, when we talk about the Housing First model, when it comes to sheltering those with substance use disorder and other needs, that those shelters are not really designed to fit, and it may not be the best setting when you have certain demographics. When I think of families moving forward, like children involved and around.
So I mean, we do have a section specifically on housing first that I'm not sure we're going to get to today, but relative to this section, are you suggesting anything specific?
I'm sorry, I couldn't hear everything you said.
I'm asking whether you have specific section suggestions for this section of the collaborative application relative to housing first. I did like the suggestion of referencing the cross CoC housing first evaluation as an example of broad participation and broad outreach. But we'll certainly review the information on housing first implementation.
Yeah, I definitely can see when you spoke of collaborating with folks from the school system, other entities throughout the city and county, of how they can be the real reflection of what is the need that sometimes get missed while shelter care tries to do their job with the intake process, right? And so it's the ones that once they pass the shelter intake of, now we get into seeing the real needs of individuals and families that might not be exposed just on those very generic questions during the intake process. Because everybody's kind of in that intake process, the bottom line is just get them placed somewhere, right? But once you get into the case management and wherever they're placed in shelter, or even sometimes before they're placed in shelter, being other services that they might be connected with through the intake process. And it's like, oh, okay, this person might have a justice involved situation that hinders housing, or this person might have a repeated of some mental health services, and the gaps in sometimes we know where uninsured insured folks, where those things arise, but it definitely plays a role with them not only maintaining stable housing, but maintaining stable employment to keep them housed. So definitely the collaborate, I mean, I'll push for, hey, most folks that I know in different sectors to take part in this conversation, because it's a real need. And unless we have the conversation that with the ones that's doing the work, sometimes data just don't project the reality of it.
Right, for sure. Okay. Thank you for the comments. All right, so we're going to continue on with 1B4. Public notification for proposals from organizations not previously awarded CoC program funding. Again, HUD wants to see thus that we have notified the public and that we are welcoming applications for application for funding from organizations that have not previously received CoC funds. Also, HUD wants to know how we've notified the public about the process of submitting project applications and how the CoC would determine which project applications would be submitted to HUD for funding. and ensure effective communication and access for persons with disabilities. 4 is somewhat duplicative of, I think, the 1B3 regarding people with disabilities. This is what we've done thus far. If there's any comments about anything in this section, and I think is close to our character limit of 2,500 characters.
Well, if you're looking for more characters, an easy fix is changing the August 7th, 2023 to 8/7/2023.
That's it.
If you needed more space, that
Gotcha.
just sticks out to me.
All right. Any other comments about 1B4?
Can you say more about number 4 when it says public meetings? And how's the public notices the public meetings and include guidance?
So I think it's important to read you the question, Regina, and that way you can see what number 4 is responding to. So it is about describe how our CoC notified the public by ensuring effective communication and access for all folks with disabilities, including the availability of accessible electronic formats. So that's really all that particular section is asking about. And so we're responding how we did that here.
Okay, thank you.
Mhm.
I'm very pleased that the city website has an ADA link on the top of each page. It's really in the banner of the city's website concerning website accessibility and assistive technologies, and invites people who need assistance with technology to contact the city, and we work on that.
Is there any public data available to show like the percentages of involvement with that and the successes or some challenges with that?
I would suspect those who manage the city's website would have that kind of information. We're not aware of it. I'll try to send a message and ask for information about that in preparation for our next meeting.
Thank you.
Mhm. All right. Any other comments on number 4? 1B4. If not, we'll move on to 1C, coordination. You can see coordination is a big part of the collaborative application, and really, I think I noted last time that overall, the points available for coordination and engagement are increasing from, I think, 85 points last year to 87 points this year. So This is another table. 1C1, as says in the chart, select yes or no for entities listed that are included in your CoC's coordination, planning, and operations of projects that serve these various groups of peoples experiencing homelessness or those at risk of homelessness. Select non-existent if the organization does not exist within the CoC. In terms of funding collaboratives, Ricky, can you confirm that the funding collaborative to address family homelessness is still collaborating, still operational?
Yeah, so we are still communicating with FMF and UMD and the Durham Partnership for Children.
Okay.
Currently, but there is a plan to dismantle that collaborative, but I don't think that would be into well into 2020.
Okay. In terms of, thank you. So that's what we're relying on with this, saying yes on number 1. Number 2, probably, I think a lot of these are probably, well, number 2, I think, probably could be a no, unless the Partnership for a Healthy Durham, or excuse me, not what's the Partnership for Children? Is that the one that's part of the funding collaborative?
Yeah,
Are they involved with Head Start program?
I want to say absolutely, but let me confirm.
Okay. So I think that's where we would have the opportunity to say yes for number 2 on Head Start. Funded through local governments. Obviously, that would be our department. Funded through other federal resources. I think we could say yes, and that our department is also distributing CDBG funds, ESP as well. Funded through private entities, including foundations. I think this would be acknowledging that many of our nonprofit organizations like Housing for New Hope do get funding from other private organizations as well. Certainly matching funds are included there. Housing and services programs funded through state government. We can say yes because of state ESG funding. Funded through U.S. Department of Health and Human Services. I think that would kind of connect with Alliance and SAMHSA funding. Housing and Services funded through the U.S. Department of Justice. Kind of connects with the DCRC. Maybe a stretch. We may want to say no there, really. HOPWA is operated through our department and the entitlement of funding. And I don't know if Mel was on the call this morning, but she is a member of the homelessness team. Non-existent for number 10. Organizations led by and serving Black, Brown, and Indigenous and other people of color. Can we have some organizations headed by, led by and serving people of color, notably right now, Urban Ministries, the LGBTQ Center for Row 12. Regina's mentioned organizations led by and serving people with disabilities. Private foundations, I think, except as they are funding nonprofit partners, we don't have direct CoC connections with private foundations. Good, I think, with the Durham Housing Authority, Runaway and Homeless Youth, and TANF is through the Department of Social Services. I don't know if we want to list any other entities that are included in our CoC's coordination, planning, and operations of projects. Any comments about this table?
Lloyd, I just wanted, I had to step away. As you know, I've only been at FMF a little over a month, and I just asked Tasha Melvin about the status of the collaborative, and she said that for all intents and purposes, it's still meeting quarterly, but it's really effectively over. So I don't know if that answer needs to be modified or not, but and I had even heard that from Sheldon before I left UMD, that was the case, that the collaborative was, for all intents and purposes, was done. So I just wanted to add that to the conversation.
Okay, thank you. I'm gonna make a note of that. We'll probably change 1C1 then to no on funding collaboratives, unless anybody is aware of any other funding collaboratives that are really operational. Unless we say, well, I think we can say non-existent. Probably one I'm gonna move that to. Thank you for that, Bill. Okay, moving on, CoC consultation with ESG program recipients. I think I changed this section substantially yesterday to more clearly indicate that the CoC's governance charter really gives a lot of responsibility for consultation and planning, allocating program funds to the Policy and Planning Committee, and evaluating and reporting performance of ESG recipients and subrecipients to the Performance Management Committee. So I'm going to hopefully we'll have a revision of that for consideration at a future meeting. And then I think questions 3 and 4 are pretty much what this current draft says. And I think we generally score pretty well for this, I believe. And I highlighted that we make presentations to colleagues in CBD, reviewing the PIT count, our housing inventory count, and system performance measures. And we're trusting that HUD understands what SPM stands for. Moving on to 1C3, this connects beginnings. I think I'm understanding on number 1, conducted mandatory training. I understand that Philip Miller's presentations in April and May referenced this, and we I think work to make it mandatory for CoC and ESG funded service providers. We're asking applicants to confirm that they either participated in those trainings or have watched the recordings of those trainings. Anti-discrimination policies. We're not aware of any non-compliance, so there was no need to seek assistance from HUD. On that. 1C4 begins to get into working with Durham Public Schools. we consider Durham Public Schools both a youth education provider, well, all three really, a youth education provider, a local education agency, and the school district. And I think also Durham Tech, as well as NC Central University and Duke, could be considered youth education providers as well. And not sure, don't think there's real clear definition of what qualifies as a, okay, it does say, let's see, youth education providers can include public and private or charter schools, trade schools, job training, and other specialized programs such as Youth Build and Job Corps, or there might be other types of youth education providers within a CoC. So I think that certainly would include Durham Public Schools as well as Durham Tech, and we do collaborate with them. Primarily, I did review the response given here with Ebony Ross as well as Natalie Beyer from the Durham Public Schools School Board, and they approved this this draft in this section. 1C4B, I think I'm still working with Jeffrey as well as with Ebony Ross from the Durham Public Schools to confirm that we are doing a good job of informing individuals and families who become homeless of their eligibility for educational services. We have language in our written standards regarding this, but we want to make sure it's actually happening as we intend it to. And I think, Regina, you may have had some comments about this, right, earlier?
Yes, I'm just in listening mode right now. Thank you.
Okay.
But yeah,
Okay.
it does play a role, and I see it's a great need for
Okay.
connections and partnerships.
Yep, we one of the things we're happy about is that our CoC board did approve state ESG funding targeting families experiencing unsheltered homelessness, so that hopefully next year Ricky's organization, Housing for New Hope, will be able to do more to help unsheltered homeless families get back into housing, although it's not necessarily a lot of funding. Early childhood partnerships, this is an area where except for row 8 public pre-K with partnerships with Durham Public Schools, and sounds like we really should delete row 10. I'm understanding that, so we'll do that. That's not really applicable any longer, sadly.
Wait a minute, we're still meeting. But are you saying, do we have a MOU with the CoC?
Right.
Well, I don't think we do.
I think at one time the CoC was listed on that agreement, but if it's really not operational, I think we can delete it. I can see there's lots of opportunities here for more work, Anthony.
I'm taking lots of notes.
1C5 gets into addressing the needs of TV and Wawa. Primarily, we have collaboration with DCRC, the Durham Crisis Response Center. We do need to update our policy. Perhaps one or the other of you participated in the webinar yesterday afternoon about the reauthorization of WAWA that Congress made in 2022, which clearly established broadened the definition of Category 4 of homelessness, referencing domestic violence to also include the idea and the reality that survivors who are experiencing trauma are also included under Category 4's definition of homelessness. So we need to update our policy. If people have any comments about this section, I think this is pretty up to date. Jeffrey, we need you to confirm that our coordinated entry system is still screening people using heart, humiliation, afraid, rape, and kick.
Lloyd, Jeffrey had to jump off for another meeting a while back.
Okay, no worries. We'll come back to that. Uh, 5B, coordinated annual training. This is something that probably needs further revision. We I don't think did an annual training this year. I don't know if we can get an annual training completed by September 28th.
But I want to make mention, for some reason, I don't know if this happened with everybody else, this meeting was put on the calendar for only an hour and not 90 minutes. And so I think we have taken folks way over if that is the case.
Okay.
And we should be mindful of that. And first of all, thank you all. If your calendar says an hour and we've kept you, 86 minutes, we apologize. We usually schedule these for 90-minute sessions, and the 60-minute time block may have been an error. So Lloyd, I just want to make you aware of that.
All right, so I appreciate you making me aware of that. And with that, I think we're gonna conclude then, and at least give you back 3 or 4 minutes of your time. Sorry for any confusion about that, but in the future, please plan for 90-minute sessions for the next 3 sessions, and we'll continue to work through this. Feel free, as you may have additional comments as you review these drafts. Please send Anthony and me, Lloyd Schmeidler, any comments and suggestions for improving the collaborative application. We want to have a strong application this year and get as much CoC funding as we can. Thanks for your participation today. We'll continue to be in touch and look forward to your continued participation in this effort. Have a great day.
Thank you.
I
Thank
put
you
my
all.
contact info, number, and email in the chat. So if anybody needs that and would like to reach out to us, please feel free to reach out with your questions or feedback as you continue to read through the application.
Thank you.
Okay.
When
Thank
will
you.
the
Thanks,
next
everybody.
meeting
Appreciate
be,
your
Lloyd?
involvement. Take care. Bye-bye.
Lloyd, when will the next meeting be? Was there a
Next meeting
schedule?
is 2 weeks from today, August 25th,
Okay, thank you.
10 a.m., 90 minutes long. Thank you. Bye-bye.